Staker here with Westside-Medical. Today I'm going to do this video for you golfers out there that suffer from that low back pain. So first, let's look at the posture that most golfers assume, be it putting or striking the ball. So first you have them, bend at the knees and your arms hang, so you have that motion right there where your hands can pass to the knees for your shots. And so you're going to be in this position the majority of the golfing sport, so to speak here. So this posture here, what it causes is you're going to get tightness in your hip flexors, which can compress the spine, and then you look at your posterior chain here, rectors and your glutes. That's what's supporting your weight, so you develop adhesions in there. With those adhesions, it's kind of like your muscle, it functions as a rubber band. When you get adhesion, it becomes more like a rope. And so you go through that range of motion, and the rope keeps pulling, gets more and more irritated, get hypoxia, irritation, pain, as well as it throws off your range of motion for your golf swing. And also, some people think, I golf, my back's going to get stronger. What happens is golf is repetitive stress, and the low back muscles here, the deep erectors, actually become hypertonic. So you're in this position here, what it means is the muscles are tight and they're weak. And so I'm going to show you some ways how to address that. To get your swing back on track, and maybe add an extra 30 yards to your drive. I don't know, I don't promise it, but remember, drive's only for show. So let's demonstrate here first. Here's a foam roller. You can get these at Westside Barbell. What this is going to do is going to help break up those adhesions in the low back as well as the glute muscles. So the first move we like to do, put it on the floor. Get your hips on the floor here. You're going to lock your hands underneath your thighs and lift your glutes up off the floor. And you're just going to roll that low back. You start in the center position. Do it about 3 to 5. Then you roll to your right side, either side. 3 to 5. That's going to get your QL, your quadratus lumbar muscle that gets tight golfing. And then you roll to the left side. About 3 to 5. You can also get your upper back here to work on your thoracic extension, which will help your golf swing. So you put your hands over your head, roll it like that, and mobilize it. And next, for the glute muscles, foam roller on the floor. Start with the legs straight, and you're just going to roll back and forth on that glute to release those muscular adhesions there. And then you take your leg and you cross it over, staying on that same side. This is going to work out that piriformis. Once again, do about 3 to 5 minutes, 3 to 5 reps on it. If you find like a really tender spot, kind of just work it. It's going to hurt. It's not going to be pleasant, but no pain, no gain, right? So after you address those adhesions, now you want to work on your hip flexion that's tight. So you want to actually work on extending it, opening it up. So what we like to do in my office, use one of these therapy bands. Once again, you can get them at Westside Barbell. Put this around the leg, foot up, and drop it in here like this. The purpose of this here, it stretches your rectus femoris, or it's the quad muscle that actually crosses over the hip joint. So by bending this, it's going to get that hip joint also. You want to sit nice and straight. You want to make sure your glute stays tight. If you relax your glute and just sag, you're not working the hip flexor here. So you want to sit up nice and tall. And you want to hold this position for 2 minutes, at least. If you don't hold it for 2 minutes, you're not doing squat. So you got to hold it, minimum 2 minutes. Anything after 2 minutes is bonus because it's going to add to that hip extension. And you kind of can play around with it, sink back, just work it. And this is probably not going to feel good either. It's going to be tight. It's going to be a little sore, but it'll pay off in spades. So once we address this, now we want to address hypertonic low back muscles. So we'll go right through here. We'll come around here to our reverse hyper machine. Now this reverse hyper is awesome for working those hypertonic low back muscles that golfers get. What it does is it's going to put your lumbar spine through its full range of motion. So it's going to address the tightness, and also you have that, like I said, that stretching of the low back muscles, and then with the contraction, that's going to address the weakness. So it's kind of a twofold approach. So let me demonstrate here. So you step on the one peg here, step on the other. You're going to get your hips on it. You want your pivot point right around the femur head. Grab onto whatever peg's comfortable. Abdominal brace. It's going to go this range of motion. Nice strengthening there of the low back muscles. And you get that nice stretch. So it's going to address those hypertonic muscles. So start off with 3 sets of 10. Add weight. Eventually work up to 4 to 5 sets of 10. And do this about twice a week. And your low back will be feeling great in no time. To see more of this product, visit Westside-Medical.com.